Hello, Slush. It's great to be back here again and see this amazing event take place again. Today I'll talk about two things. First, I'll start with the highlights of our journey in the last 3 years. And then I drill down 6 learnings that we have gotten over the last 36 months. I started the company after a personal struggle in healthcare. In my family, we were struggling for almost 10 years on finding the right doctors. First in Finland, and then 7 years ago when I moved to San Francisco in the US. I got so fed up into the system that I had to do something about it. I founded the company 2011 with my co-founder, Tapio Tolvanen. He's my longtime Nokia colleague and one of the best developers I know. We started the company on a premise of helping people find the right doctor in a simple way. We launched the service 2012 at Health 2.0, one of the big healthcare events in the US. And that's what the service looked like. Very different than today, but it did the basic thing, helping people find the right doctor who accepts their insurance plan. The next milestone what we got was seed round funding in May 2013. It was really exciting to get some of the key investors, SoftTech VC, Lifeline Ventures, 500 startups, and Initial Capital to believe in our story. This gave a big boost for the team and to the founders that we are doing something valuable that other people also believe in. Last year, I came to Slush for the first time, half accidentally ended up into the contest, and we won the whole thing. It was pretty amazing. This ended up being also a big motivation booster for our team and helped us to get more attention in our investment circles. Then a few months later, we ended up raising a 10 million A round led by NEA. And it is pretty telling that we picked a list of investors we want after Slush. And NEA was #1 on the list. And we were able to get them on board. They're one of the few investors who really understand healthcare and also consumer web. What do we do today? We help people find a great doctor on web, on the mobile. For the doctors, we provide simple tools that help them get new patients. So we are a matchmaking service. We have spent 3 years on building the best database of doctors anywhere. What we try to do in the long term, in the vision, is really to make the healthcare system in the US more transparent and help people when they are in trouble. We already helped 15 million people find a new doctor. That's a pretty interesting impact. And how we measure everything in the company is by the impact that we can have. To make this impact even bigger, we just recently announced that we now have an API. So we are providing a public API to other people who want to add doctor search on their services. And we hope that this will expand us from 15 million to the next 100 million people we can help. So let's move to another topic. So what did we learn in the last 36 months? These are some of the key things that me and my co-founder were thinking last week when we looked at what are the things that we really care deeply about and what are the things that we were surprised about. So first, you need to pick a right market. And this is pretty hard. How do you know what is the right market? Because you can build an amazing service today or great game, and if the market is not ready, or if the market is out of fashion, you might not be able to get funding. So you really don't know what to do there. Our case is very lucky. We started in 2011. That was the time when we had no idea about Obamacare and all the big changes in healthcare in the US market. And if you look at the VC funding here, basically we went from 1 billion funding in a year to 4 billion in funding this year. So there's a big interest now in this market for the first time. And this really makes me excited. And I also heard that here are 164 companies in the Slush that are in the healthcare realm. That's a lot more than last year or year before. But you also need to keep in mind that the markets can go out of fashion quickly. So what if something happens in the political scene in the US and let's say the Obamacare is repealed? It could make the market not exciting anymore for the investors. So you need to think about the macro economy as a small startup. The second learning really is, and this is almost a no-brainer for us, but you need to build a great foundation. You need to have the right founders, you need to have the right team, and you also need to have investors who not only give you money, but can also help you when you have hard decisions to make or hard problems to solve. You also want to have advisors and board members who can help you. At BetterDoctor, we've been trying to build a very versatile team who can help us when we get into trouble, and that happens pretty often. Thirdly, you need to build great products. This is almost a no-brainer now. You need to build a product that works. And if you think about the whole idea of the startup lean methodology now, you can build, test, learn. Build, test, learn. And then you can make better products. You need to be quick and fast at learning and rapid at iteration. Design is really important today. Apple has changed our mindset and made us think about design a lot more. Even if you are designing a B2B product, you need to make it good. You need to make it very usable. But at the same time, design is nothing without a great engineering. You need to make product that works. In BetterDoctor, we think ourselves as a data-driven product company. Half the people in the company code every day. And if you think in Silicon Valley today, everybody are trying to learn to code. And the engineers are the kings. The fourth learning is a really hard one. For many of us Finns, who are not the most natural salespeople, it's really hard to go out there and sell your story, start a fundraising. And there are a couple of things I wanted to highlight today. So we learned pretty hard way that when you start fundraising, you can only start it in a few times a year. So if you start in beginning of the year, you do it in January, February, or March, or then you start in August and September. You try to close the round before summer holidays or before New Year. If you start to fundraise now, it might be really hard because there's a Christmas coming, the New Year, people take vacation. You might lose the momentum. The second thing here, you need to always keep a good momentum. You need to show traction when you are fundraising. Think about it in a way that the investors have a small peek window into your company. They're not following you multiple years. They follow you 1 to 5 months. So within that time, you want to overly report. You want to show momentum. You want to show great traction. And you also want to keep in mind that when you are fundraising, you always want to have more than one investor. You want to have more than one term sheet in your hand. That helps you close quickly and get to the right valuation. And what you need to do, you need to always pitch fearlessly. You need to go out there. You need to love your product because you're going to do it a lot. It's not something that, if you can't like your product, you can't do it. You need to love it. You need to live it. With my co-founder, Tapio Tolvanen, we have met 100 different investors. We have done over 200 different pitches. And I calculated yesterday that we've been driving from San Francisco to Sand Hill Road so many times. It's, I think, 5,500 miles. That's crazy. So another learning that I think Mikkel already highlighted earlier from Zendesk, that you want to plan. You want to have a good plan that you can believe yourself, that your team will believe, and that your investors can believe in. But then you will change it. I mean, there's no plan that will last. And there's a great example of one thing that we changed very quickly in the company. We started with the idea with Tapio that we want to build one office in San Francisco. We had been working multiple years in teams at Nokia and running teams that were all over the world. We had teams in India, in Europe, in the US. And we really wanted to do something simple, do it in one location. And that's what happened. We have now 6 different teams, 6 different sites. We have most people in San Francisco. We have a small support team in Texas. We have 1 person in New York. We have a small development team in Finland. We have a data science team in Omsk, Siberia. And we have a data cleanup team in Philippines. So it looks kind of messy, but it's all by design. We only did this because we had some great opportunities that we could take up and just seize in the right moment. The last learning is not very evident one. But if you think about it, you often are worried about the competition. But you rarely lose because of the competition. You are much more likely to lose because you can't implement your own inability to build things quickly. So I wouldn't really keep too much focus on the competition. And I think Peter Thiel is putting really well on his latest book, 0 to 1, when he says that competition is in your mind. That's a very good learning. As a summary, so what you need to do, you want to pick the right market. It's hard, I know, but you need to do it. You need to build a strong foundation and hire a great team. You need to build great products. You need to time your fundraising right. You need to make plans, and then you want to change them. That always happens. And the competition is only in your mind. Don't worry about it. If you want to talk to me later or contact me, you can send me a note at Twitter at BetterDoctor or send me email at ari@betterdoctor.com. I'm always happy to help new companies. And let's see where we take next. We are now in the 3-year mark. What we heard from Zendesk, I think they went from in 6 years from zero to IPO. So that's our aim today. And let's see how we do it. Thank you so much. Kiitos.